Today on the program, we turn our attention to an important public health issue affecting many Nigerians: preventable visual impairment. We will explore the common causes of preventable vision loss, the importance of early detection and treatment, and the practical steps individuals and families can take to protect their eye health. Stay with us as we shed light on this important issue and discuss how, through awareness and timely intervention, we can help prevent avoidable vision loss in Nigeria. This is Health and Wellbeing here on ASO TV channel 392. Please follow, subscribe, like and share our YouTube page at ASO Radio and TV. Let's take a short break, and when we come back, you'll get to meet our guests as we begin our conversation.
Hi everyone, here are some practical tips on what you should do to avoid breast cancer.
Examine your breast on your birthday of each month. For instance, if you're born on the 12th of May, examine your breast every 12th of each month. Get familiar with the shape, the sizes and the textures of your breast and nipple. Don't forget to check your armpits for lumps.
Reduce the intake of fried foods. The oils used to fry many fried foods release chemicals that can be harmful to your body.
Eat lots of vegetables. This contains the nutrients that your body needs to help fight off diseases.
Tooth and gum diseases have been linked to cancer, memory loss, heart diseases, dementia, and stroke. Make sure you brush at least twice a day, especially before you go to bed. If you can, floss regularly and have your teeth checked at least once every year.
Reduce your exposure to toxins by minimizing your use of hairsprays and deodorants containing aluminum and leads as much as possible.
Avoid smoking.
Exercise regularly, at least 3 times a week.
If you have babies, make sure you breastfeed exclusively for at least 6 months.
As women, you should avoid placing your smartphone in your breast pocket or inside your bra. Some believe that this would emit high levels of radiation which could lead to breast cancer and other forms of cancer. Secondly, you should avoid or limit your intake of highly processed foods, aka junk foods, as they contain toxins that are harmful to the body.
Welcome back from the break. Joining me today for this important discussion is Dr. Sewuese Bitto. She is a consultant ophthalmic surgeon, neuro-ophthalmologist, and public health ophthalmologist with the Department of Ophthalmology at the Federal Medical Center here in Abuja. She is also the secretary of the Conference Planning Committee of the Ophthalmological Society of Nigeria. Of course, they are preparing for their 51st Annual General Meeting and Scientific Conference. This year's conference is tagged Abuja ASO 2026. Welcome, Ma.
Thank you so much for having me on the channel today.
Okay, we'll also be joined by the program here by Dr. David Ejeba from the Department of Ophthalmology, University of Abuja Teaching Hospital, Gwagwalada. He is the Publicity and Media Subcommittee Lead of the Conference Planning Committee of the Ophthalmological Society of Nigeria's 51st Annual General Meeting and Scientific Conference. Of course, he will continue this discussion in the after the break. Okay, so we'll be speaking with Dr. Bitto. Dr. Sewuese, again, welcome to the program.
Thank you so much.
Okay, so let's get right into this discussion. Looking at the causes,
Okay.
Causes of blindness, the factors, how we can prevent vision loss and all of that. When would you advise that we actually take a visit to the doctor, to the eye doctor?
All right. Thank you so much for having me on the program. And hello to every Nigerian. Thanks for joining us. Let's quickly talk about the causes of visual impairment and blindness. So we'll take it from there.
Okay.
According to the National Visual Impairment and Blindness Survey, which was conducted between 2005 and 2007 within Nigeria across the country, we had staggering statistics coming out of that survey, which projected and told us that cataract is the commonest cause of blindness and visual impairment. And that's just not for Nigeria, that's international as well, across the world, it's global. And the figure specific to cataract amongst Nigerians was about 45% of Nigerians had blindness or visual impairment from cataract. So that means, very simply put, about 45 people out of 100. So if we put together 100 people in Nigeria who have visual impairment and blindness, 45 of them would have that blindness or visual impairment from cataracts. And so that's simply put. And that tells you that the burden is very huge. In terms of numbers, we also found out that over 4 million people at the time had visual impairment and blindness, or amongst people that were 40 and above. More than half of that number were cataract patients. So over 2 million at the time. Our population is probably larger now, so the burden is actually larger now. And based on that, we have other causes of blindness. However, cataract is a cause of avoidable blindness. So that means that if we put in the right kind of intervention, the safe kind of surgical intervention, the person can see again, either in one eye or in two eyes. And so that's why we are placing emphasis on this group of patients for this pre-conference activity that we're having. As the secretary of the the conference planning committee of the Ophthalmological Society of Nigeria 51st Annual General Meeting and Scientific Conference, headed by Professor Regina Morgan, who is our chairperson, and our co-chair, who is Professor Fatima Kiari. And we also have a vice chairman in the person of Dr. Joseph Ezichila. We have an entire team of distinguished ophthalmologists heading various aspects of the planning of this conference. And we've come together to say, we're not only going to focus on ophthalmologists who are coming in to get updated, to get trained and retrained, unlearn and relearn in terms of scientific content. No. How about we also give back to the community, which was why we said, let us go out now and set out a certain aspect of the budget, which we also have a lot of companies who have come in to partner with us to say, can we conduct 500 free cataract surgeries?
Okay.
You see that? So that's the basis. The burden is high, and we also want to say, how can our communities benefit
from it?
Yes.
Okay, so now back to the question, when should we visit the doctor? At what point? What are the signs? What are the symptoms that should say, Lami, see, that eye has been itching you for too long, or you've had that pain for too long, go visit the doctor?
Okay. Interestingly, when we have eye issues, many Nigerians just typically would just default and go to a chemist. So let me just use this opportunity to say this question is very apt and very important for us to emphasize that if there's any issue of an injury to the eye, if there's a chemical injury into your eye, apart from ensuring that you put in a lot of water, just keep irrigating until you get to the hospital. Please, if there's any issue at all, a road traffic accident, a home accident, minor accident, school accident, a pencil in the eye, a broomstick in the eye, please present at the hospital. That's a general advice. However, some of these causes of visual impairment and blindness are silent. No redness, no itching, nothing, no pain. They exist in the eye silently and take away vision. One typical culprit is glaucoma. I'll say that again, glaucoma. That eye disease is targeted at the optic nerve of the eye, which connects the wire that connects the eye to the brain. Glaucoma won't give you a sign. Glaucoma takes away vision silently. Thus, it is called the silent thief of sight. So, why should we now check our eyes? Because of this kind of disease, you don't need to wait until someone splashes acid into the eye or you have an injury in the eye before you come to us. Please make sure you check your eyes once every year.
Okay.
More so for individuals who are 40 years and above. Please make sure you check your eyes once every year.
Okay, Dr. Bitto has actually taken me to the next point. Okay, she has answered the next question of the importance of checking our eyes regularly. So, you had spoken about the burden of cataract in our society, talking about Nigeria here, and how overwhelming it is. Of course, that has led to the importance of this outreach that your organization is putting up for us to benefit as a people. What is the burden of cataract-related impairments in Nigeria?
Okay.
As against, of course, we have, I don't know, astigmatism.
Glaucoma, refractive errors, yes,
Okay.
and all of that. Yes.
Not a professional.
No, it's okay, it's fine, thank you.
So, please.
Yes. So it's important for us to emphasize again that cataracts are the commonest cause of avoidable blindness.
Yes.
Yes. So I had talked about the numbers earlier. Almost about half of Nigerians who have vision impairment or who are blind are that way on account of cataract. So you can see that the magnitude or the burden that cataract places on our communities in terms of visual impairment and blindness is really high. And when that happens to a breadwinner within a family, we now begin to see the secondary effects, economic effects on that family. Okay? Even when it happens to the elderly who may have retired within our family systems and our communities, a younger person within the family is forced to leave the economic arena of that family, reducing the money coming in, and is pushed home to say, take care of mama, take care of baba. Do you see that now?
Yes.
So you can see that we just have a lot of consequences when we have members of our society affected by cataract. And that is what we are trying to say. How can we, as a society, the Ophthalmological Society of Nigeria, come into it and actively do something about it now? That's what we are trained for. That's what we've always done. And this is one more opportunity for us to emphasize it. The reason why we're here, so that Nigerians can hear a lot more about it and be involved, So I'm sure Dr. Ejeba would also emphasize
on that.
The cataract screening and surgical camp aspect.
I had just mentioned before we came on set that when we hear about eye issues and the need to go for surgery, it kind of, makes us scared. It makes us scared, not just because of the technological aspect and all of that, but then the question is, why so?
Yes.
Why should we be afraid of surgeries? Why are people afraid of going in for surgeries? Even now that, of course, we've had a lot of advancement in terms of surgical procedures. Why are people still afraid of going in for surgeries?
Yeah, thank you so much. This is a very, very valid question. And it speaks to the root of culture.
Yeah?
I will start by saying it's the same thing when we say, why do some people just hate anything foreign? That's for instance. Some of us are used to a culture of eating a certain type of way. And when we're exposed to a different type of menu, we say, no, I don't want that. I don't like that. That's as simple as it is. To the extent, some people just say, why should I go to primary school? Why should I go to secondary school? It's foreign to me. They don't want to pick foreign cultures. Now, let us now move into the aspect of healthcare. Culturally, we are used to how we have been raised over the centuries, how we have applied medicine to our system to help us. Medicine has evolved tremendously over the years, more so now in the 21st century. And you're dealing with family systems and cultural systems that have held on to what they've known for centuries, decades, millennia. And we're saying, no, 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 no. What you knew is not sufficient. Now we want to introduce this to you. So, eye surgery, same as surgery to bring out a baby from a woman's womb, will not necessarily be accepted. Some women will tell you, I'd rather have this baby through vaginal delivery. Meanwhile, we know the risk that that baby has already through that decision the mother is taking, more so to the life of the mother. That can be equated to eye surgery as well. Okay. Many of us are not open, naturally open to foreign ideas. And so that is another thing that creates the fear and say, my eyes. No, I'd rather just stay the way I am. It's not like a baby needs to come out to stay alive. So, well, what's the issue? I can just be blind in one eye. But they don't understand the magnitude and the burden it places on the society. So we need to create awareness. It is a safe procedure. Please, it is valid to have the fear. We understand that. However, please try and just create a little openness. These surgeons have been trained properly to handle these procedures, and the whole point is to restore vision. So it's not something that should make us feel too scared, want to run away. And furthermore, I want to highlight that at this point, many times in our rural communities, even when we're trying to run away from the traditional trained medical doctors who are the ophthalmologists to do the surgeries, we many times are quick to agree to the malam who just comes into the community and puts in some tool to push in the cataract into the vitreous of the eye. That's even worse. So that tells you culture. Because he is seen, yes, he's seen as a safer person. Meanwhile, he's the bigger danger because he's causing more blindness. So please, this is something we will have to continue educating Nigerians on, informing Nigerians on. We want to promote eye health. And that's why we're here, and we're grateful for the partnership that ASO Radio and TV is giving us to shout out, to amplify the voice of eye health. Please go to the hospital. Let the doctors and the specialists tell you what the problem is. We'll give you time to make up your mind when you want to come for the surgery. Please don't let the cultures in your communities just use a tool that is not sterilized, number one. Number two, relocate the cataract that is causing blindness into the back of your eye. That's even worse. They see for just a few minutes and that's the end. And they now have a lot of inflammation and worsen blindness. And we really can't do so much about that kind of blindness at that point. You've converted an avoidable blindness
into a permanent one.
Yes, an irreversible blindness. So these are the issues. I may even also want to speak a little bit about the factors. I don't know if you'd want that.
Okay.
Yes.
Dr. Bitto is just, she's going like this and going like this. And I'm excited that you're happy about speaking about
that's the work we do.
You're passionate about your work. It's seen, we can see it. So yes, take us through the factors that causes blindness so that we know what to look out for. We know what to avoid.
In fact, I was going to highlight the factors that make it difficult for people to come out.
Okay.
What that survey also told us was that women were 2 times more common to have cataract compared to men.
Why?
It was what the study found out. So what it meant, it could have implied to us that men were more likely to have access to cataract surgery. So at the time of doing the survey, More women were picked because women may not have been going out. Some women, in some cultures, you have a culture that keeps women a little more inside, may not be educated, may not be allowed to go to the hospital without a man in the family going with her, a father or a husband. So the burden was more in women from that study. I don't know if you're understanding what I'm saying.
Relate with that.
The study also proved to us that we had higher burden in the rural areas compared to the urban. I think you may understand that because we have more expertise in the urban areas and more access.
Yeah.
Right. So that tells us that when we are addressing cataract surgery and the burden of blindness, we also need to address these vulnerable groups. Yes,
Sure.
we need to. Access. The first problem we have is cost. Cataract surgery is not cheap.
Yeah.
It's not like cataract surgery of a century ago. No. We have evolved, better machines are used, increased expertise is involved, so it's not cheap. That's a problem.
Okay.
Access. Not every rural community has trained eye personnel available at the primary healthcare centers to do the surgeries. That's a very expensive system to run. It may not be possible in this country. However, we should be able to get people who require these surgeries from the primary healthcare system a little up to the secondary and be able to access the care. Some communities don't have motorable roads. Some are riverine areas. Access, transportation is required to bring them out to where the expertise is available. Another issue is the gross deficit of trained experts across the country. Yeah. We are a country of over 250 million. I'm sure about that, I think. And at the moment, we have a very low number of trained ophthalmologists that serve the community. That's a problem.
Important.
A huge. So the expertise is available, but it's not sufficient. How do we want to beat down the burden? So we need training. We need to expand, escalate in terms of numbers of training. But you know, when you do the training, are you also putting in facilities in place to keep the resource you have trained within the country? That's another issue. Okay. So you see, when we have these kinds of conversations, these are the issues that we need to highlight. So government partnerships, public-private partnerships, we just need to all come together. The burden is humongous. It is not bigger than us. We're Nigerians, we can do it. And we just really need as many as can hear this cry, partner with us to assist us to get our Nigerian eyes seen again.
Okay, thank you very much, Dr. Bitto. Okay, we have been speaking to Dr. Sewuese Bitto. She is a consultant ophthalmologic surgeon, neuro-ophthalmologist, and a public health ophthalmologist with the Department of Ophthalmology at the Federal Medical Center here in Abuja. She is acting as the secretary of the Conference Planning Committee of the Ophthalmological Society of Nigeria, the 51st Annual General Meeting and Scientific Conference, which is coming up very soon here in Abuja, and it is tagged Abuja ASO 2026. Are you hearing that? ASO Radio and TV, Abuja ASO.
Exactly.
Okay. Thank you very much, Dr. Bitto, for joining us on this
opportunity
conversation. So we'll take a short break, and when we come back, we'll be speaking with Dr. David Ejeba.
Hi everyone, here are some practical tips on what you should do to avoid breast cancer.
Examine your breast on your birthday of each month. For instance, if you're born on the 12th of May, examine your breast every 12th of each month. Get familiar with the shape, the sizes, and the textures of your breast and nipple. Don't forget to check your armpits for lumps.
Reduce the intake of fried foods. The oils used to fry many fried foods release chemicals that can be harmful to your body.
Eat lots of vegetables. This contains the nutrients that your body needs to help fight off diseases.
Tooth and gum diseases have been linked to cancer, memory loss, heart diseases, dementia, and stroke. Make sure you brush at least twice a day, especially before you go to bed. If you can, floss regularly and have your teeth checked at least once every year.
Reduce your exposure to toxins by minimizing your use of hairsprays and deodorants containing aluminum and lead as much as possible.
Avoid smoking.
Exercise regularly, at least 3 times a week.
If you have babies, make sure you breastfeed exclusively for at least 6 months.
As women, you should avoid placing your smartphone in your breast pocket or inside your bra. Some believe that this will emit high levels of radiation which could lead to breast cancer and other forms of cancer. Secondly, you should avoid or limit your intake of highly processed foods, aka junk foods, as they contain toxins that are harmful to the body.
Welcome back from the break. Before we went on the break, we spoke with Dr. Sewuese Bitto, and she spoke to us about the causes of cataract, the signs, the symptoms, and of course, all the things that comes with cataract as it were, and I hope you listened properly. Now to continue this conversation, we have with us in the studio Dr. David Ejeba. He is from the Department of Ophthalmology at the University of Abuja Teaching Hospital, Gwagwalada. He is also the Publicity and Media Subcommittee Lead of the Conference Planning Committee of the Ophthalmological Society of Nigeria, 51st Annual General Meeting and Scientific Conference. Welcome, Dr. David.
Thank you for having me. Good morning.
Good morning. So now let's turn our attention to the 500 free cataract surgery outreach organized by the Ophthalmological Society of Nigeria. This is a project as part of the activities to mark the 51st Annual General Meeting and Annual Scientific Conference, which is to hold here in Abuja. Okay? So what is the main objective of this free cataract surgery outreach, and why is this initiative considered necessary at this time?
Okay, thank you very much for having me. The main initiative of this
Objective of the initiative.
objective of the initiative is our way of giving back to the society as a body, the Ophthalmological Society of Nigeria. As part of our conference activities, we try to reach out to Nigerians who cannot afford, healthcare, eye healthcare. Our particular interest is in cataract right now, because cataract is, like was stated earlier, a major cause of avoidable blindness, and a lot of people have this problem who cannot afford the surgery. So we have thought about it and deemed it fit to invite Nigerians to participate in the surgery and have their sight restored in the process. Thank you.
Can you take us through on the category of people that will be benefiting from this in outreach?
Okay, like I said earlier, people that cannot afford the surgery. Sometimes the surgery can be very expensive, depending on the type of surgery and where you are getting the service. It can cost up to 1 million naira, hundreds of thousands of naira. So those that cannot afford are the people we are focusing on. And those in the rural areas, the underserved, people in the community who ordinarily, without this outreach, cannot afford these services and living, with the problem of blindness in the community. So those are the people we are focusing on.
Okay. I know that to be able to cater for over about 500 people, of course, in the course of this outreach, you cannot do that alone. You're not doing it alone.
Definitely.
So what role is the government or the government hospitals? What roles are they playing, talking about private partnerships and of course other development partners playing in ensuring that this initiative is a reality?
Yes, as was stated earlier, we have about 4 government hospitals involved in this. University of Abuja Teaching Hospital, Federal Medical Center, Jabi, Asokoro District Hospital, General Hospital Maraba. These are all government hospitals, and they are playing a role, a very important role, by giving us access to the clinic environment, the theater, and even the expertise. Most of the surgeons that are going to participate in this surgery are ophthalmologists, from the government hospitals. So there's a lot they are contributing to the success of this program already.
Okay. So outside of the government hospitals and of course the technologists that are there, are there external partners also
Definitely.
contributing to this?
Yes, there are NGOs, Sight Savers, Dunes Foundation, AMA Foundation. They are sponsoring, the program in one way or the other. Some are providing consumables for the program. Some are providing equipment for the program. Some donated money to make sure that we reach these 500 Nigerians who need these cataract surgeries.
Okay, Dr. Ejeba, before we go, your final words.
Okay.
What do you have to say to us?
It promises to be very exciting. A lot of people are going to be reached in the course of this outreach. And we really thank the Ophthalmological Society of Nigeria for giving us this opportunity to reach Nigerians, as well as the government hospitals who have opened their doors for us to see these patients, as well as the sponsors of this program. So we invite every Nigerian who need this service, this cataract surgery, to come en masse, and we'll take care of them. Thank you very much for having me.
Okay, we've taken doctor's final words, but before we go, please help us with the list again of those general hospitals where this can be accessed.
Okay, the University of Abuja Teaching Hospital, Gwagwalada, Federal Medical Center, Jabi, Asokoro District Hospital, and General Hospital, Mararaba. Yes, those are the 4 hospitals.
Okay, so that is to say, if you're within any of these axes or closer to any of them, you can actually access this. So if you have any relative, any friend, regardless of where they are, when is the activity taking place?
Oh, yes. On the 27th and 28th of August, that's this coming Thursday and Friday. Screening is ongoing. It started 2 weeks ago. It's ongoing until we get the numbers for the surgery.
Okay.
Yes.
So there we have it from Dr. David Ejeba. If you are within this category and you think that you need help, like Dr. Bitto says, do not be afraid. There is no big deal to having this surgery done. And it's not as complicated as it used to be before. So it's something that before you say Jack, done. Okay? So please avail yourself of this opportunity. It's a once in a lifetime opportunity, being that today is all we've got, right? We do not have tomorrow. It is not promised to us. So please make sure to take advantage of this opportunity and reach out to everyone who needs to get this information to ensure that they get the help that they deserve. Thank you so much, Dr. Sewuese Bitto, consultant ophthalmic surgeon, neuro-ophthalmologist, and public health ophthalmologist, Department of Ophthalmology, Federal Medical Center, Abuja. He is the Secretary of the Conference Planning Committee of the Ophthalmological Society of Nigeria, first annual general meeting and scientific conference, which is set to hold very soon here in Abuja, and it's tagged Abuja ASO 2026. Thank you also, Dr. David Ejeba of the Department of Ophthalmology, University of Abuja Teaching Hospital, Gwagwalada. So you'll be seeing him if you're going for that operation at Gwagwalada Hospital. He is the publicity and media subcommittee lead of the Conference Planning Committee for the upcoming event of the Ophthalmological Society of Nigeria. So thank you so much for coming in to give us this information. It's helpful to me, and I'm sure that I'm going to take the word out there to as many as need it. I know my brothers in Kogi State and around may need this information. So trust me to take it out. Thank you both. And thank you all our viewers for making sure that you stuck to this station to get this very valuable and insightful perspective on eye health. We truly appreciate your time and contribution to this important discussion on preventing avoidable blindness and protecting eye health here in Nigeria. Thank you for staying tuned to ASO TV channel 392. Join us again next week for another enlightening edition of the program. I remain Lami and Bravo. Please follow, subscribe, like, and share our YouTube page at ASO Radio and TV. Thank you, and remember to stay healthy for us and